But this is a huge reason why 80% of people that get autoimmune disease are women, but it is a huge driver of cancer. So women with estrogen dominance before menopause don't just have twice the risk of breast cancer before menopause or 3 times the risk. They have a 5.4 times increased risk of breast cancer before menopause and a 10 times greater risk of malignant cancers, the ones that start one place and metastasize other places, the really bad ones, 10 times greater risk their whole life. And so when this stuff happens early, we go, well, let's fix it because you don't need any of this stuff, but let's fix it so that we really do our due diligence to prevent you from getting the autoimmune disease, prevent the breast cancer, prevents all cancers,
Right.
rather than just telling them, well, that's part of being a woman and then doing nothing to prevent this stuff from coming in the future.
Welcome to the Optimized Woman, the podcast for high-performing women ready to take back their health. I'm Orshi McNaughton, a board-certified holistic health practitioner and functional nutritionist. If you're tired of feeling stuck, you can't lose the weight no matter what you do, your energy is in the toilet, your metabolism feels like it's at a standstill, and you lost the spark you once had, then you're in the right place. We are here to unleash the unstoppable force you're meant to be and give you the tools to fix what's holding you back. So if you're ready to own it, start thriving again and live the life you deserve, and let's get to it. Hey, welcome friends. Today I'm thrilled to be joined by Dr. David Bilstrom, a quadruple board-certified MD in functional and regenerative medicine who's transforming the treatment of autoimmune disease worldwide. In this episode, we expose the hidden impact of estrogen dominance in women and its direct link to autoimmune diseases. We dive deep into how hormonal chaos, gut health issues, and chronic inflammation create the perfect storm that leaves many women suffering in silence with unexplained symptoms. So let's dive into this important topic.
I've always been very interested in chronic health issues, both preventing them, but also trying to reverse them and all this. So my original area of specialty was spinal cord injury rehabilitation. So as a rehab doc specializing in spinal cord injury, everybody that I saw was either paralyzed from the neck down or the waist down. And it's an incredibly challenging population to help. There really aren't a lot of meds that can help them, or if you try to use meds for a myriad of health issues that they have to try to deal with, the side effects are always really problematic and lead to new things. And so after a while, I was saying, geez, wouldn't it be lovely if there's some things we could do to help these folks in every organ system in the body being affected? And wouldn't it be lovely if there wasn't any side effects? And as I kept kind of trying to dive deeper into that concept, acupuncture kept popping up, potentially being really great for about anything, but also no side effects. So actually, I decided to train. I trained out of UCLA about 3 decades ago. And oh my gosh, did it work so much better than I ever thought it would. And I'm like, well, how did I never learn this in my traditional training? If I didn't learn this, what else is out there? And this has led to about a 3-decade search that also not only was I boarded in physical medicine rehab, but then medical acupuncture, but then now I'm also boarded in functional and regenerative medicine and integrative medicine. And then with 4 different sort of paradigms on how the body works all put together, it's been very clear sort of, what drives chronic health issues and how to prevent them before you get there, and what everything that might happen to somebody that's not exactly perfect tells you about what's going on, but also to reverse all chronic disease, including preventing cancer, reversing the reason why you might get cancer. So if you get breast cancer once, you never want it again, how you can do that, but also reversing autoimmune disease, all of which is just in epidemic proportions, unfortunately.
So you started in the allopathic space and traditionally trained initially, right? But you noticed a lot of gaps in your own medical training. I'm assuming that's why you went to acupuncture and then all the other alternative routes, because you realized, and I don't want to put words in your mouth, but I'm assuming that you didn't just want to be writing prescriptions to people, but you really wanted to address some of the underlying issues that people had, right? And based on all this extra training that you picked up over 30 years, that eventually led you to autoimmune disease. Why did you narrow your focus to that?
It was almost kind of a natural progression. You just don't get answers when you start getting these symptoms until you finally get, hey, by the way, you got this autoimmune disease, but then the options offered are really not great. And so just inherently, I started seeing more and more people. But then I read this absolutely heartbreaking story out of the New York Times where this really famous journalist was not only losing her career, but her life to lupus, one of the autoimmune diseases. And the story that she shared in the New York Times was one that I'd heard hundreds of times already. Multiple years, things getting worse and worse. Nobody can find an answer, compromising quality of life, everything in the life. And then, oh, by the way, you got this autoimmune disease. Well, the only thing they're offered is kind of a medicine that puts a bandage on a few symptoms, but doesn't fix it. So you never feel great, but then it just gets worse and worse. And I'm like, oh my gosh, somebody's got to change the way that autoimmune disease is dealt with everywhere worldwide. Well, it might as well be me. And so about 10 years ago is when I made the shift to, well, somebody's got to change this because this just, it's too sad when it happens to everybody and it's happening so much.
I'm assuming when you saw the population of people that were coming to you for autoimmune disease, you probably saw so many women, a very large percentage. What would you say the percentage of people that see you that are female versus male?
About 80% of people that get autoimmune disease are women. So I see probably about 80% women, about 15% children, including the cutest little 10-month-olds with a knee the size of a basketball with juvenile rheumatoid arthritis.
Oh my God.
So this is really a disease of women and children for the most part.
For children, is this a new thing or is this something that was happening even decades ago? Or is it just that the population is getting younger and younger?
Well, I think it's just becoming more and more challenging to stay healthy as time goes on. So we're really seeing a huge explosion of all the things they call the civilization diseases. All these things are just so much more common now than they used to be. So these things happened, but not nearly as much. So in a perfect world, if you look at sort of hey, how many people have autoimmune disease? Well, what they tend to do is they tend to count like the top 10 autoimmune diseases. Now, there's really just one disease that can attack any body part, but there's hundreds of body parts that can be attacked when it comes to autoimmune disease. So when I was in med school, the numbers were 1 in 400 people in the US had autoimmune disease. Now the number is 1 in 9, but they're really just counting the top 10. And if you look at things like the autoimmune disease that I named back in 2018 and first showed up in a textbook in 2020, 300,000 women of childbearing age in the United States have this one particular autoimmune disease that I mentioned. Type 1 diabetes is an autoimmune disease. 20,000 young people under the age of 18 in the US get diagnosed with type 1 diabetes every year now. Over 300,000 with type 1 diabetes in the US. It is just this huge explosion in the numbers. And it's sad because they are preventable, but people are never told how to prevent them, but they're also reversible for the most part as well, but people just aren't told that information.
So you've described estrogen dominance as one of the most dangerous issues for women. Why do you believe this and how is it connected to autoimmune disease?
Yeah, so hormones are very important in how the body works. They all keep away inflammation. And by keeping away inflammation, they keep away disease. So like, for example, one of the 2 estrogens that women make called estradiol, you need estradiol to keep away heart attacks and strokes. You need to keep away cataracts and macular degeneration, very important for the eyes. You need it to keep away osteoporosis. It keeps away fine lines and wrinkles in your skin, keeps the gut healthy. So it's a lovely thing. But oftentimes it may not be so much what one hormone is doing to another hormone. A lot of times it's the balance. The body really likes balance. And in women, the hormones have this huge symphony orchestra, and it's not hard to throw it off. Now, it's not necessarily hard to fix it, but it's thrown off so often nowadays in women. Women tend not to know what the early signs of this hormone symphony being thrown off. Oftentimes they're told, well, that's just part of a woman. That's just part of being a woman. And they go, oh, well, there's nothing wrong. That's just part of being a woman. They don't realize what it really means. And so estrogen dominance is when a woman has too much estrogen compared to progesterone, both really important. Every cell in the body has receptors for estrogen and progesterone. Every cell in the body needs them, but the balance is so important. And when the balance gets thrown off, estrogen dominance occurs. And if you look at the top 10 reasons why women die, estrogen dominance is probably playing a part in about 90%, not just autoimmune disease and cancer being the flip side of the same coin, this autoimmune disease, but also is tied in with Alzheimer's, dementia, heart attack, stroke, osteoporosis, all these different things that are so profoundly bad, and it happens so commonly, but women just aren't told what are the signs of early estrogen dominance, and then told how to fix it long before they ever get to that point.
I definitely want to individually drill down on everything you just mentioned and kind of dive into hormonal imbalances. But before we do that, I would love to just get a simple explanation of what is autoimmune disease and how does it function at the fundamental level.
Sure. So there's two parts of the immune system. One part of the immune system is called the adaptive immune system. And the adaptive immune system is able to make really specific antibodies to go after a very specific something that's not us, that's going to hurt us. And so, for example, if we get the cold virus in us, the virus is not us, it's just going to hurt us. So the adaptive immune system will make specific antibodies for that specific virus, kill it, knock it out of the system. So if we get a cold, we don't have it for 20 years, we have it for like 4 to 5 days. But then things can happen where the immune system will actually start making antibodies against our own body parts. Things like Hashimoto's, let's say, where you actually make an antibodies attacking our own thyroid, and then you can't make thyroid hormone, and somebody's identified as, oh, you're hypothyroid. You might need thyroid medicine. And so it's never going to be a good idea to make antibodies attacking our own body parts. We're basically self-destructing when that happens. Never a good idea to self-destruct. But then now we understand that the other part of the immune system, called the innate immune system, which is vitally important in controlling excessive inflammation so it doesn't create chronic disease, that is also part of this whole immune system dysregulation that drives not just autoimmune disease, but as I kind of referenced before, all disease. This is why it's tied into things like heart attacks and strokes and dementia, Alzheimer's, osteoporosis, all these different things that are so common in women, unfortunately.
So mention that women don't necessarily recognize the signs of these hormonal imbalances, the estrogen dominance. So why is hormonal imbalance and estrogen dominance is often overlooked in women's healthcare? And how come women ourselves, we can't really recognize the signs?
So estrogen dominance, too much estrogen relative to the progesterone, is the number one driver, a huge driver of all hormonal menstrual things. Things like bad flows, bad cramps, premenstrual syndrome, ovarian cyst, polycystic ovarian syndrome, fibroids, endometriosis, fibrocystic breast disease, and even infertility. And so when you look at the population, it's like, oh my gosh, what women, just about almost what doesn't have some of that? That's all estrogen dominance.
Yeah.
And then unfortunately, when this stuff goes on, and I hear this story a lot, let's say like a teenage girl in high school, all of a sudden she has this unexpected, profound menstrual flow sitting at her desk in high school. And then they go to the doc and they're like, oh my gosh, this was so embarrassing. It was so terrible. The school nurse probably gave her a pair of white sweatpants to go back to class in. And you're like, oh, no, it's going to happen again. And they go, oh, well, that's just part of being a woman. Terrible cramps. Oh my, terrible. Well, that's just part of being a woman. You just got to live with it. And I go, oh my gosh, that is not how it works. That should not work. It should, none of that stuff should be there. But then also because estrogen revs and progesterone calms, you get rev without calm things, such as a woman becomes kind of an excessive worrier, more anxious than she should be, panic attacks even, but also insomnia, sleep disruption. And so if you look at the hormonal menstrual things or the rev without calm things, it's almost nowadays what woman doesn't have some of that. Unfortunately, they're not told why it is, which is this estrogen dominance. Instead, it's just kind of bandages are put on it. So oftentimes with the hormonal menstrual things, women are just given oral birth control pills, which are estrogen based. So now they may have stopped the bad flows, bad cramps, that kind of stuff, but you basically just made the estrogen dominance worse because you gave them estrogen based products. Oh my gosh, that's even worse. And then when it comes to the rev without calm things, it might be, well, here's some Xanax. That's going to, make you calmer, but it's not fixing the problem. And that estrogen dominance just keeps rolling along. And it's not hard to fix all this stuff, make all the hormonal menstrual stuff go away, create the calm, make the rev without calm stuff go away. But when you miss this opportunity of, well, what does this really mean? This is not just, oh, it's part of being a woman. Sorry to tell you that. It's really this estrogen dominance. The interventions either missed the mark, missed the opportunity to treat it at that stage, or even make it worse, like with the estrogen-based oral birth control pills. But this is a huge reason why 80% of people that get autoimmune disease are women. But it is a huge driver of cancer. So women with estrogen dominance before menopause don't just have twice the risk of breast cancer before menopause or 3 times the risk. They have a 5.4 times increased risk of breast cancer before menopause and a 10 times greater risk of malignant cancers, the ones that start one place and metastasize other places, the really bad ones, 10 times greater risk their whole life. And so when this stuff happens early, we go, well, let's fix it because you don't need any of this stuff, but let's fix it so that we really do our due diligence to prevent you from getting the autoimmune disease, prevent the breast cancer, prevents all cancers, right, rather than just telling them, well, that's part of being a woman and then doing nothing to prevent this stuff from coming in the future.
Yeah, I think the standard pill for everybody is birth control pill. As far as I remember, that's what I was given when I was that age automatically. And most women then stay on birth control pill sometimes for decades or some sort of a hormonal birth control that is really so antiquated now. And we know so many things about it as being so bad for you, but yet that's still the standard of care in many ways. And so especially for young women, maybe even teenagers or women in their early 20s, what causes this imbalance? Is it that we have too much estrogen? Is it that we have too little progesterone? What happens there? What's causing this dysregulation?
There's several different things play into this, and it kind of depends on when you have it. And so if a woman starts her menstrual cycles, menarche, right away with any of these bad hormonal menstrual things, typically I'm thinking that the stress hormone cortisol, or more probably correctly, the HPA axis, hypothalamus pituitary gland, adrenal gland, which is what makes cortisol, the HPA axis cortisol is how our body deals with stress. And things like adverse childhood events that happen at young ages is such a huge driver of chronic disease in general. Fortunately, it's kind of getting more and more press at how profoundly bad this is. So things like, as a young person, there's in the family, like divorce, separation, substance abuse, incarceration, physical, verbal, sexual abuse, trauma, these kind of things, they really throw off the HPA axis, how our body deals with stress and cortisol. And so if a woman starts with really bad menstrual stuff right from the get-go, as soon as they start their cycles, I'm usually thinking that this stress response as cortisol got thrown off, and now it's thrown off the entire symphony orchestra immediately. If it tends to happen like, oh, I started my cycles and they're pretty unremarkable, this is fine, but then they get thrown off either in teenage years or 20s or whatever, I'm usually thinking it could be cortisol, this HPA axis also, because stress loves to throw off the hormonal symphony, but also a huge one is gut disruption. So things like maybe recurrent and frequent use of antibiotics as a young person, ear infections, strep throat sinus infections, a lot of meds will do it, like Motrins and Advils and other kind of things. It really throws off the gut and the intestinal microbiome. You get a disruption of the good-bad mix, which then creates a leaky gut. Now, when the stress of either this disrupted gut or maybe the stress of the disrupted HPA axis, the first hormone that tends to drop is progesterone. And so you might still be maintaining good estrogen levels, but you drop progesterone. And then you start developing this estrogen dominance. But then when it really gets rolling, including this gut disruption, ovaries will make new healthy estrogens to do all this wonderful stuff. But once they've been in the system for a while, they get dinged, they get beat up. Now they're toxic and irritating to the system. You got to run your detox pathways, dump them into the gut, and poop them in the toilet, because most toxic things in the body have to go poop in the toilet. But when you get this intestinal dysbiosis, the intestinal microbiome is run off, it creates a leaky gut. And then toxic things in the gut will not go in the toilet. They'll leak back into the bloodstream and accumulate over time. So then you got the double whammy of now you lost progesterone. Maybe it's even showing up as, I'm worrying and I'm anxious. I may not sleep well already, but then now you got excessive estrogen that just builds over time because you can't get rid of the toxic old estrogens. Oh my gosh, this double whammy just starts throwing all this stuff off.
So you have the HPA axis dysfunction that could start early, potentially childhood experiences. It could be maybe the teenagers being on devices all the time, not being outdoors. There's so many things that could create this chronic stress even that young age, which is so sad because stress resiliency should be so good still. When you're a teenager, you should be able to bounce back much easier and recover. So I don't tend to see that until women get into like perimenopause. And then it gets really bad for a lot of women. But when you start seeing that in your practice with kids and teenagers, that is really bad, because then as we get into our mid 30s, 40s, it just gets exponentially worse. And I think that's when you start seeing the autoimmune diseases pop up mostly, right? Kind of midlife.
Well, I tell you, when this stuff gets rolling, it can roll pretty quick. The body's spectacular at keeping itself healthy. It is just remarkably great. But this stuff can get rolling. We see 20-year-olds with like 6 autoimmune diseases already.
Oh my gosh.
When it gets rolling, it really can get rolling. But to your point, the body is so good at keeping itself healthy, you can get all these disruptions really early and kind of hang in there, but it might only show up with cancer and autoimmune disease in the 40s or 50s, possibly.
Yeah.
You can see it coming like 2 decades ahead of time.
I'm just wondering, can you talk a little bit more about the immune system? Like, how does the immune system's function relate to chronic disease? And there are things that we didn't traditionally link were autoimmune related. We are finding out they are. Can you speak to that a little bit?
Yeah. So the things that tend to drive the immune system disruption, fortunately, the science is really clear. And so things like vitamin deficiencies, hormone imbalances, gut disruption, cortisol, and that HPA axis disruption. And then we now know that infections are part of all chronic disease. They just tend to be infections that are different than the infections that drive obvious disease. They don't give you a fever when they get into the system. They just kind of hide from the immune system, no fever. But then they start creating this chronic smoldering inflammation over time. Now, the immune system ideally is trying to protect us. But when it gets told the wrong information, it might start making these antibodies attacking our own body parts. And if you're attacking a body part, excess inflammation builds and creates chronic disease. And then the innate immune system's ability to control excessive inflammation allows different body parts to just get more and more inflammation. And then that drives chronic disease. And so this is where we've known for a long time, for example, like if the oral microbiome is disrupted, it creates gingivitis and gum disease, cavities. Well, these bad bugs can translocate from the mouth to the bloodstream, go to the vasculature. And 20 years ago, they said, oh, if you have, gingivitis, disrupted oral microbiome, that's going to increase your risk of heart attack and stroke. But we now know that there's a lot of bad bugs in the gut that because of the intestinal microbiome disruption, leaky gut, they'll translocate from the gut to the bloodstream, go these different body parts, and start creating chronic inflammation. So I just did a series of lectures for Breast Cancer Awareness Month. And it was kind of a sad month for me because everybody on TV, these doctors that were talking about this, they say the key to breast cancer is early detection. Mammography and self-exam. I go like, well, no, you're not going to do anything to prevent it. Nothing to prevent it. You're just going to say, well, when you get it, we'll find it early. And I said, well, no, that the key to breast cancer is prevention. And truly, cancer being the flip side of the same coin as autoimmune disease, we should be able to prevent 95% of all breast cancer. But then if the few people that slip through the cracks, you want early detection. But things like we're talking about, well, this is where breast cancer comes from, including the studies that I talked about was disrupted intestinal microbiome, leaky gut, translocation of bad bugs in the gut, a lot of them called enteroviruses. One type that we test on everybody has autoimmune chronic diseases called Coxsackie virus. There's 6 different kinds that get tested. They like to translocate into the bloodstream and go to the breast tissue, for example. So Coxsackie B3 translocates to the breast tissue, disrupting the breast microbiome, driving breast cancer. And they talk about the intestinal microbiome breast axis, but then Coxsackie B4 likes to translocate to the bloodstream, go to the cells in the pancreas that create insulin, knock out insulin production. And here's this intestinal microbiome, pancreatic beta islet cell axis. You can't make insulin. You need insulin pumps, insulin shots, type 1 diabetes. So these infections that get all over the place really mess things up. But then the immune system will go investigate these areas of excessive inflammation. And ideally, we have cells, for example, that are supposed to put out inflammation. But there's already so much inflammation in that body part that the immune system gets disrupted. And actually, those cells, rather than turning into ones that get rid of inflammation, they turn into cells that make inflammation. And so then you get these body parts that become this engine of inflammation. They have all this inflammation. but then the disrupted immune system makes more inflammation and more disruption. And it's just this engine of inflammation in these different body parts. And what you got to do is kind of break the cycle with these right interventions. And then you've done your due diligence to prevent the cancer and the autoimmune disease, but also you've done your due diligence to prevent things like the Alzheimer's, the dementias, all these other things you don't want either.
We already sort of touched on that women experience higher rates of autoimmune disease compared to men. And some of the contributing factors also could be environmental toxins, and the rising rates of chronic diseases could be very much linked to that. Can you speak to the role of autoimmune disease sort of connection to environmental toxins?
Yeah, so toxins getting into the system from the outside is so prevalent nowadays, including in children. Pretty much every child nowadays is born with high levels of lead, flame retardants, pesticides, herbicides, all these kind of things. So they really start behind the 8 ball right away. So the toxins really create a lot of stress and throw off cortisol and the HPA axis. The toxins like to change how our DNA, our genes are expressed. So we start turning on bad genes and turning off good genes in every cell in our body at the same time. The ability to detox and clear these toxins, environmental toxins out of the system, kind of overwhelm the ability to detox. And then you can't do a good job getting rid of these old toxic estrogens, and they start building. So really the environmental toxins just impact the system in so many bad ways. And unfortunately, it's not so much how can I avoid these things, because they're just everywhere. It's almost more like, well, can I get rid of them faster than they're coming in? Can my detox pathways work well enough? Do I have the nutrients to do that? And then if I dump them into the gut, can I keep the leaky gut away, the gut healthy enough that I do poop them in the toilet? And so it's very important to keep the system healthy so you can get rid of them faster than they're coming in. Otherwise, they start building over time, creating disease.
And then women on top of that also wear the most makeup and tend to use the most chemical and fragrance products and things that they put on their own body in much more numbers than women. They also may be doing the cleaning and exposed to all the cleaning products in the house. And there's just so much that our system just cannot deal with it anymore. And I think it also has just gotten exponentially better over the decades, right? There's just more and more toxins in our environment. Exactly as you said, like for me personally, I had a whole bunch of mercury silver fillings when I was young. And in my early 30s, I actually had them removed. But back then, I didn't know that you had to do it in a certain way to avoid this mercury exposure. And so I had them removed without all the safety precautions in place. And within like 6 months is when I was diagnosed with Hashimoto's, like after I had all these mercury fillings taken out. And I, of course, in my 40s, when I realized this, I didn't really understand this until maybe like 10 years later when I had all these health issues popped up as a consequence of that I was still, even now, I'm still trying to detox mercury from my body in many ways that sort of built up. But it's just very interesting how I learned about my autoimmune issue right after this pretty big environmental it's an exposure from my own mouth, but basically I thought I was doing something really good by getting those out of my mouth, but then clearly the way they drill them out and me inhaling them during the procedure and all the fumes that I inhaled, it actually got deeper into my tissues. And so I think that is just one really big toxin. And then in addition, we are all exposed to hundreds of other toxins, right?
Oh,
So
absolutely.
do you see that trigger connection with a lot of people?
Oh, I do. Yeah, yeah. Including just this last week, a cute little girl was diagnosed with terrible lead toxicity at age 1. And then
Oh my
here at
gosh.
age 1.5, developed juvenile rheumatoid arthritis, for example. And so this toxicity, it doesn't even have to be, that dramatic a toxicity like your story or other, just that kind of buildup over time is enough just to overwhelm the system and just start whacking the immune system.
I would love to go back to talk about the gut connection a little bit more. So the gut sort of considered the central mechanism in autoimmunity and chronic disease. Can you speak to a little bit of like the role of the intestinal barrier? What role is that play in our immune system? And then also the concept of molecular mimicry, particularly with gluten and food sensitivities, and how they may even be responsible for like joint pain and other issues that we can identify later as autoimmune disease.
Yeah. So 80% of the immune system surrounds the gut. And so whenever you see any kind of immune system issue, and when you think of the immune system, it's a great example how the body likes balance, where you never want to be too high or too low in anything. So, but when the immune system loses set point right in the middle, you actually move away from it both up and down at the same time. So the overactive immune system issues are all the autoimmune diseases, as well as allergies, asthma, and the skin issue, eczema. And then the underactive immune system issues are things like colds and flus and infections, getting the same infection over and over again. The infections that drive chronic disease, like the Coxsackie virus, Epstein-Barr virus, mycoplasma, these kind of things, and then cancer. And so whenever you see an immune system thing, you go, okay, what's going on with the gut? And so ideally, when we eat food, the nutrients, the vitamins, the minerals, the proteins, the fatty acids, they need to get absorbed from the gut into the bloodstream, go all over, and then, maintain health, keep the body going. But then it's very selective. There's a barrier that allows only good things in, but not bad things, because there's a lot of crap in the gut that has to be pooped in the toilet, right? You don't want that stuff getting into the bloodstream. But then things like stress, oral birth control pills, Motrins and Advils, all the acid blocking medicines, metformin that people get put on for blood sugar control issues, antibiotics, terrible. They create what they call leaky gut. Now that term was thrown out for decades and really poo-pooed by mainstream medicine. But then they go, oh, okay, we see what's going on here. We're going to call it intestinal permeability disorder. We're going to make it sound really complicated so people think it's too complicated for them to understand. But basically, you have these things called tight junctions that you reference between cells. And so they basically look like my knuckles together, and they only let certain things from the gut to the bloodstream. But those tight junctions get disrupted, they open up, and then bad things such as proteins can leak from the gut out through the gut wall and then start interacting with the immune system. And if there's proteins that the immune system is seeing that should not be there, the immune system says, oh, that must be our enemy. You're not supposed to be here. Now, ideally, you think, well, if it was a bad bug, like a bad bug that could hurt us, the immune system goes, oh, I see the protein on you, bad bug. You're our enemy. I'm going to kill you. I'm going to start making antibodies, let's say, to go after you and kill you. You go, all right, immune system, you're doing the job. But then if it's undigested food proteins that get there, like wheat proteins, 62 different kinds, gluten's one of them that tend to be really easily messing things up. The immune system goes, oh, well, you're not supposed to be here. You're a protein that's not here. You must be our enemy. We're going to make antibodies attack you. So then you start making antibodies against food proteins. You start developing these food sensitivities. And the classic one for chronic disease is the IgG, where they call it the delayed hypersensitivity reaction. When it comes to IgA and IgE reactions, those are the immediate hypersensitivity reactions to foods. People eat a food. Every time they do, they don't feel well. People can figure that out there in any test we have. The skin test for foods bugging us is wholly unreliable. They only check for the immediate hypersensitivity reaction, the immediate reaction, but people can figure this out there in the test. The IgG tend to be the delayed hypersensitivity reaction. This is where we eat a certain food protein and the proteins keep circling in our system for weeks or even up to a month later, sometimes even longer. But weeks or month later, after eating it, not even eating it for a whole month, all of a sudden whacks you with inflammation. The immune system gets overactive, whacks you with inflammation. And then all this inflammation starts building over time until people go, geez, where's all this inflammation coming from? I know it's got to be something. I've read that nothing is age related till 90. So I'm less than 90. I got a health issue. It can't be age. It must be something else. Well, I know it's not what I'm eating because nothing makes me feel sick. Well, it doesn't make you feel sick right away. It makes you feel the sneaky way. So you start developing antibodies attacking all these food proteins. And now the foods start whacking the system every time you eat them. But then also, so this molecular mimicry that you mentioned, bad bugs get from the gut to where the immune system is, or bad bugs get from the outside world in us, like herpes virus 6, mycoplasma, some of these other guys, and they get in, and the immune system has to decide, just like it would with the food, are you friend or foe? You're not human. I got to decide if you're friend or foe. So like wheat comes in, that's not human, or cow's milk dairy, that's not human, or a bug gets in, that's not human. So ideally the body goes, oh, well, you're an infection. You're not human, but you're our foe. I'll make antibodies and get rid of you like a common cold. But then the body may go, geez, that protein on you, bad bug, is so similar to that protein on that thyroid. Huh. Well, if you're an enemy, that protein on the thyroid might be our enemy. I better start making antibodies attacking that protein to the thyroid, and here's Hashimoto's thyroiditis. Or food comes in and you go, okay, friend or foe. You'd like to think that, well, it's friend because it's food, but it goes, well, you could be foe. But then I see this protein on the brain, right, where the folic acid, one of the B vitamins, folic acid receptors are. You might be our enemy too. Well, I better make antibodies attacking you. And then the immune system makes antibodies attack on the folic acid receptors in the brain. And this is what drives 70% of all autism is one particular autoimmune disease, where you attack the receptors on folic acid in the brain, knock them out. Even if you have folic acid, it can't attach and keep the brain healthy. You start getting all this neurologic thing. The proteins that have come in that create this molecular mimicry in that situation are the animal milk proteins. So cow and camel milk proteins are the worst. Goat and sheep are next. But there's about a 90% correlation between the structure of the animal milk proteins and those receptors on the folic acid receptors in the brain, just like there's a super correlation between the bad bug that got in the body and that protein on the thyroid. And then here you start attacking thyroid because of the molecular mimicry as well.
So do you have your patient population get on a certain diet, or do you test them first for food sensitivities, or what is your process of determining, what to avoid?
Yeah, so and it's a very important thing to know. So there are certain health issues that you say, oh, I know with your health issue that you have either wheat, 62 different kinds, gluten's one, or cow's milk dairy. So like autoimmune disease, it's both the wheat and the cow's milk dairy. Butter's okay because it's not protein. It's actually a really, really good fat for the gut. If somebody has enough brain stuff to get in the way of stuff, doesn't matter what the brain thing is, if it's getting in the way of stuff, you got a wheat issue. If you got recurrent canker sores, mouth sores, you got a wheat issue. If you're an adult with acne, you got a wheat issue. If you're a teenager with mild acne, it could be a million things. But if you're moderate to severe acne as a teenager, you got wheat for sure. And probably about 90% of the time, you're going to have cow's milk dairy. And so if people come in with any of that stuff, we say, well, let's get rid of the ones we know, that one or two we know, and see how you feel between the first visit and then, let's say, 6 weeks later when we're going to go over lab tests. And if 6 weeks later you go, oh my gosh, I am feeling so much better already. You got to be kidding me. I've had all this stuff and I'm feeling so much better after 6 weeks just doing this. I say, well, isn't that a great example of how great the body is? It is so good at fixing stuff. You may have had this stuff for a long time, but within 6 weeks, you're feeling so much better. Your body's been waiting this whole time. It's been biding its time, waiting for its opportunity to fix you. And by getting rid of this food protein, all of a sudden it goes whoop, and fixes you. But also I say, well, great. But if you come back and you go, oh, well, I did pretty good with that stuff, avoidance, but I'm not really feeling that much better. Maybe my gut's a little better, but now, well, then we say, okay, well, we still know those proteins are bugging you, but you probably have others bugging you too. And that's when things like a food sensitivity test is very important. Whereas a little finger prick test, you tend to fill in a couple little drops of blood, let it dry, mails off to a company that could run like 96 different foods. And then you can pinpoint exactly which ones are bugging somebody in the sneaky manner and which ones aren't. And then you temporarily get rid of the ones that are bugging you in the sneaky manner. And it truly opens up the window of opportunity to fix everything. Because now you don't have foods creating inflammation in a sneaky manner. Every time you eat them, building the inflammation, building disease. But then once somebody's about 80 to 85% better in everything, because no matter what health issues somebody has, they're all connected. It's not like one body part, one body, it's all different. It's like, no, they're all connected. So you're really in a position to correct everything at the same time if you go after these really big central mechanisms. So once somebody's about 80, 85% better overall, we usually say, hey, there's a good chance your gut's so healthy now that not only do you feel tons better, but you probably fix these food sensitivities. So we start bringing them back in one at a time in a special way called the formal food challenge, one food per week. And then we ask people to eat this food that we're challenging the body with twice a day for 3 days straight, and then stop using it for 4 more days and just see how the week goes. And if the week is, hey, everything's still fine, that didn't bother me, you fixed it, you can eat it all you want again. If you go, ooh, that didn't feel so good, well, then you go, okay, let's get it back out for 3 months again. We'll keep doing all our work. We'll try it again 3 months later. And maybe it takes 1, 2, 3, 4 times, but eventually, for the most part, people can fix these food sensitivities and they don't bother you anymore.
So besides the food sensitivity testing, I know you have a pretty extensive blood panel that you recommend people start with. Is there any other testing that you do automatically? Do you do any GI testing or anything else?
Yeah, so the blood test, we look for a couple of vitamin and mineral deficiencies, just a couple. Some tests look for thousands. I don't find we need to do that because if you take care of a couple of the big ones that you need a lot of, like magnesium or zinc and that kind of stuff, as the gut heals, you're just going to absorb nutrients from your food so much better, and you're going to fix most of the vitamin deficiencies yourself. So let's look at hormones, and then we really look closely at these infections that drive chronic disease. But typically, if we can, we always run a digestive stool analysis, which takes a really close look at the gut, where you poop, you put them in a couple little tubes, you mail it off, and then it tells us incredibly great information about the gut and what's going on down there. And these are tests that really can't be run for the most part at your typical hospital or clinic. This is more of that advanced testing, but getting a chance to look at the gut like that and then put that together with what we know from the blood test, put it together with your symptoms, all these things like, the rev without calm, the hormonal menstrual, whatever it is. Hey, have you had these adverse childhood events? We really got a sense of what's going on, and we can really pinpoint what we need to do and what we don't need to do. Because I always tell people, we hate to waste your time doing something you don't need. Let's do what you really need, but also let's do only the stuff, for the most part, that's the real big central mechanism stuff. Okay, then you're in a position to fix everything. We typically don't need to go chasing individual symptoms. We can always give a symptom a little extra attention if it's kind of slow to change, but typically if you take care of these central mechanisms, you're in a position to fix everything at the same time. The body is so smart. It's always just waiting for its opportunity to fix everything at the same time.
Hey friends, I am so excited to share that the Women's Biohacking Conference is back this year. When I first got into biohacking, I noticed that almost every major conversation in this space was being led by men, doctors, researchers, biohackers, all discussing research that was primarily tested on men. Occasionally there were female voices, but the questions that rarely came up was, how does this apply to women? Much of the research that shaped early biohacking strategies were done on men, and only recently have we started seeing more studies focused on female physiology. But it's not just about applying biohacking strategies to women's bodies, it's also about focusing on the things women actually care about: fat loss, metabolism, muscle building, hormonal balance, beauty, regenerative health. Women want science-backed answers that are actually designed for female physiology. That's why I started the Women's Biohacking Conference, and I'm bringing it back in 2025 with 2 high-impact accelerator events. In May, we are diving deep into metabolic health, fat loss, body composition, energy optimization. And then in September, we are focusing on hormones, how to navigate perimenopause, balance hormones, and enhance longevity from the inside out. So don't miss out. Head over to my website, optimizedwoman.com, and sign up now.
So let's talk about nutritional supplementation and intervention. So I know that you have a basic stack that you recommend for prevention, which is vitamin D, probiotics, and butyrate. They are essential for gut health and immune system health. Can you talk about that a little bit? Like, how did you come up with this stack? And do you recommend that preventatively? Do you recommend it for anybody that has autoimmune issues? Can you speak to that a little bit?
Yeah, so vitamin D for a long time has been identified as being profoundly important, both for prevention and reversal. So ideally in a blood test, we'd like vitamin D levels to be 70 to 90. Well, here's data that says if a woman can get her vitamin D above 60, she's automatically decreased her risk of ever getting breast cancer by 82%. 82% of the way to no breast cancer. If a woman has a vitamin D above 50 during pregnancy, she's automatically decreased the risk of her child ever getting multiple sclerosis, the autoimmune disease that attacks the brain, by 50%. All this is fantastic data. But then back in about 2015, this information started coming out about how important vitamin D receptors are. So vitamin D receptors on every cell in the body, because every cell needs it. So vitamin D should be able to attach to the receptor, tell the cell what to do. A little bit like people hear a lot about insulin receptors, insulin resistance, where every cell in the body has an insulin receptor. Insulin attached to the receptor tells the cells how to control blood sugar. Insulin resistance, you start climbing blood sugar because you can't attach and do the work. It's almost like you don't have insulin. Well, in 2015, researchers from University of Illinois Chicago said, oh my goodness, there's more vitamin D receptors in the gut than any other body part. It must be really important for the gut. But when the vitamin D receptor resistance occurs, even if you have all the vitamin D in the world, you can't attach and do the work. And they said, well, if you can fix the vitamin D receptor resistance, this is exactly what you want to do to reverse autoimmune disease of the gut, like ulcerative colitis, Crohn's disease, but also undo these recurrent C. diff and H. pylori infections, these infections that you just can't get rid of with antibiotic after antibiotic. They just drive the body crazy. But then they say, oh, if you can fix it by fixing the vitamin D receptors, it really looks like it's what you want to do for about everything. And so they talked about vitamin D, probiotics, and then using something called butyrate. Now, butyrate is a short-chain fatty acid that should be made by the good bacteria in the gut. The good bacteria in the gut make a lot of important things, including this butyrate. Well, when the good bacteria get decimated by stress, antibiotics, all the things we talked about before, they're not going to make it. So you use those three things together. I said, this is like the foundational triad. But they said, oh, this is what you got to do to fix it. But it looks like about what you want to do for everything. And so like a year later, actually like 6 months later, the same researchers published an article that said, well, this is actually a quote unquote nuclear weapon against metabolic syndrome, obesity, insulin and blood sugar issues, cholesterol issues, those kind of things. And then subsequently, all these different articles, because what happens when you fix the vitamin D receptors, you build good bacteria, get rid of bad, including like real specific good bacterial species, like one called Akkermansia muciniphila, that just rolls off the tongue, Akkermansia muciniphila. Well, that's what happens when you fix the vitamin D receptor. So here's the Harvard Journal of Psychiatry says, hey, if you can fix the gut this way, and I go, well, that's what happens when you fix vitamin D receptor resistance. You can treat major depressive disorder with this. Another psych journal says, well, if you can fix the intestinal microbiome this way, I go, well, that's the vitamin D receptor resistance. It changes personalities. People become more outgoing and more social. And even the series of videos I did last month for Breast Cancer Prevention Month, because this is Breast Cancer Prevention Month, year, decades, centuries, not just Breast Cancer Awareness Month. That article goes, hey, this is because vitamin D receptors become resistant to vitamin D, leaky gut, translocation of enteroviruses to the breast tissue driving breast cancer. You can fix it with butyrate, probiotics, and then, of course, you have to have the vitamin D, including vitamin D levels enough to do the work there. And so it turns out that this vitamin D receptor resistance is such a huge part of all this kind of stuff, including you need vitamin D receptors to be sensitive so that women can actually make important hormones. It actually helps build production of progesterone, build production of the estrogens that you need to keep everything healthy and happy. But then you get this nice cycle going. So with the vitamin D receptor sensitive, vitamin D can attach and do its work, increase estrogen and progesterone. The increased estrogen actually makes the vitamin D receptors even more sensitive. And you can make more progesterone and estrogen. So you get this ability to make healthy hormones at the right levels. And they actually help the vitamin D receptors even more. And the body just gets this flow going to really create improvement everywhere.
Just a couple of questions on vitamin D. So do you have a preference if people get it from sunshine or eating or taking cod liver oil or taking synthetic vitamin D pills, basically? I would assume that you would probably prefer sunshine and more of food sources if that was possible. But what's your take on synthetic vitamin D supplementation, and What are the dosages, and is there any certain protocols that you would recommend?
Yeah. D3 is one form you can get in supplement form. That's the more profoundly important way to do it versus the D2, which is more artificial. There's a lot of studies that say the D3 just does better work in the body when you take it orally than D2. You love to get it from sunshine. The sun's the very best. When it comes to the doses, it really depends on each individual. And this is kind of a sad thing, is there's a lot of studies out there that they go, okay, well, we're going to give this person 2,000 IU of vitamin D. Well, that's just like a drop in the bucket. Every once in a while, that's enough for somebody, but it's very rare. Most people need between 5,000 and 10,000 IU a day just to get good, or just to stay good once they get good. And sometimes you need a lot more for a variety of reasons. And so it really should be dosed based on need. Well, let's give you a dose. We'll check in 6 to 8 weeks what your level is. We'll alter the dose based on your level. It's kind of like, well, you have high blood pressure, and we got to give you a high blood pressure lowering medicine because you're going to have a stroke and a heart attack. But what we're going to do is we're going to give you just this dose, but we're never going to check your blood pressure again. We're just going to assume that this dose is going to help you. But it's like, oh, that's silly. You give a dose, you check the blood pressure. If it's the right dose, great. If not, you alter it until you get the right dose. But then in all these studies, or even clinically, they give a dose and they go, oh, that must be the right dose. We're never going to check the level. It's like, well, you just do a simple blood test and then you figure out what the right dose, but it's just different for everybody, kind of a thing. The sunlight is profoundly impactful on human health and well-being. And so the infrared spectrum, sunlight is made up of 53% infrared. And the infrared is really there within the first 3 hours after sunrise. And so it's this really beautiful mechanism where at the back of our eyes, we have the retina. Now, most retinal cells are what they call image-forming retinal cells. So light hits the image-forming retinal cells. They project information up to the part of the brain called the visual cortex so we can see images, right? But there's other cells back there called non-image-forming retinal cells. Light hits them, particularly therapeutic as infrared, but there's some benefit also from UVA and UVB at small amounts during the middle part of the day. They project to all these different brain parts, parts involved in our mood, parts involved in our emotions called the amygdala, parts involved in how we eat. Do we overeat? Do we eat between meals? Do we eat in the middle of the night? And also metabolism. Do we burn, calories well, or do we not burn calories well? It projects to the hypothalamus. So it helps us set up a really healthy HPA axis, how the body deals with stress. And it also projects to a place called the master clock, the suprachiasmatic nucleus in the brain. And the master clock oversees the 24-hour clock in the system, the circadian rhythm. Every cell in the body has a 24-hour clock. Immune system cells have a clock. Every cell has a clock. Even the intestinal microbiome has a 24-hour clock. And so when that light hits these non-image forming retinal cells projecting to the master clock, it optimizes the intestinal microbiome, optimizes ability to control inflammation, optimizes the immune system function. And so if that gets thrown off, a classic thing happens is, well, I don't sleep so great at night. Well, the circadian rhythm's off. You're not sleeping when you should, but then your body's not functioning on this great clock. And the circadian syndrome used to be thought to be basically the same thing as metabolic syndrome, obesity, insulin and blood sugar issues, sleep issues, and then cholesterol issues. But now they understand that circadian syndrome is so much more than that. It is the immune system, it's inflammation control, it's gut health, it's all this different kind of stuff. And so this is such an important central mechanism of how the system works. I did a lecture early in June in Paris where I talked about the 4 maternal microbiomes during pregnancy that determine fetal microbiomes. The fetus, before they're even born, is trying to set up a healthy intestinal microbiome before they're born, but also it's how you set up a healthy placental microbiome. So there's optimal crosstalk between the mom and the fetus and back and forth. And how you create these healthy microbiomes, what throws them off, but how to correct it. And so what a baby can do early in the second trimester, about a third of the way through the pregnancy, even though there's a lot of baby parts still to be formed about a third of the way through the pregnancy, the baby's eyes have already formed these non-image forming retinal cells. They start seeing light coming through the abdominal and the uterine wall about a third of the way through the pregnancy. Seeing light coming through is vitally important in developing all these healthy brain parts, including the baby's trying to set up a healthy HPA axis so they can deal with stress optimally even before they're born. setting it up really healthy so that they stay healthy their whole life, like we talked about with the HPA axis disruption, but also because the circadian rhythm center is being stimulated, healthy immune system, ability to control inflammation, all this different stuff. And this is one reason why the developing baby during pregnancy has an independent circadian rhythm from the mom. So the baby will, for example, sleep when the mom's awake, but maybe be awake when the mom's asleep and all this kind of stuff. So this is such a central mechanism that babies do it to develop all the parts. Well, we can actually use that same mechanism to reset the system. Well, keep you healthy in first place, but also reset the system to correct all these things that we've been talking about, including the intestinal microbiome and all that stuff.
And just a quick story on vitamin D, and just to reiterate the point you made on testing and how important that is, that I do my own blood work quite frequently, but this last summer, I just came back from Europe and I spent like 5 months traveling and I was super tan. I spent a lot of time outdoors. And so when I came back, I didn't have access to testing while I was in Europe, but I normally do my blood work very regularly. So I keep track on a lot of my biomarkers, and one of them being vitamin D. And so when I came back to the US and I ran my first test, I was expecting my vitamin D levels to be fairly high because I'm very fair skinned and I spent so much time outdoors. I was really tan. And yet my D level was just above 50, which is a decent level, but still not as optimal as I would like it to be. So the point of the story is that you should really go and get tested and know your actual levels, because you might be surprised. And knowing that most Americans are vitamin D deficient, chances are you'll probably need some.
Yeah, and that's a good example that people will kind of stop taking their vitamin D in the summer thinking that they're fine, but we retest them, or they'll maybe change brands and change from maybe a high quality to a not good quality, and their level just tanks. And even if you get a really good level on a certain dose, we always kind of say, well, it's the only thing that ever stays the same is change. So get your vitamin D tested once a year, just to make sure that that's the same right dose for you.
Yeah. One more vitamin I wanted to ask you about is the B vitamins, especially B12, and their role in managing autoimmune disease. What is the connection there?
Yeah, the B vitamins are very important. It's a good example of how the right nutrients like B vitamins really keep inflammation away. So there's a blood test called homocysteine that if it is running high, it tends to mean that you need more B vitamins. But when homocysteine is high, like in my book, I mentioned this, and then there's about 9 references, bing, 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 right across the page there, because when homocysteine is high, it basically is trying to push at everything you don't want. So high homocysteine, higher risk of heart attacks, stroke, Alzheimer's, mood issues, cancer, diabetes, osteoporosis, autoimmune disease, you name it, you don't want it. Homocysteine's high. And so B vitamins are really important to keep that from getting up there and driving chronic disease. Now, typically, B vitamins we get from our food are in a form that's not usable, inactive. And when it gets in the body, we have to methylate them, and so that they're in a usable form. And so what you'll see on supplementation in B vitamins, you always want the fully methylated version. So like for B12, unfortunately, the shots that a lot of people take are cobalamin being the B12, cyano actually being a cyanide molecule. And I was like, well, that's maybe not the greatest thing to pair with B12 if you want it. But the B12 that does the work is called methylcobalamin. And so you'd like to have plenty of methyl groups available to methylate your B vitamins, such as you get a lot of methyl groups from the cruciferous vegetables, broccoli, cauliflower, kale, those kind of things. But you also need to not only methylate your Bs to make them active so they can do all this great work and keep away chronic inflammation, chronic disease, but you also need to have great methyl groups so you can detox, turn fat-soluble toxins, such as some of the ones we talked about earlier, into water-soluble so we can poop them out, pee them out, sweat them out, that kind of thing. But also, it's really important to have good methyl group, good methylation ability so that we can fix our DNA, because our DNA, our genes tell the cells what to do. We used to think the DNA, the genes were hardwired. Whatever you got, good, bad, otherwise, from parent and grandparents. Hopefully you got the good stuff. But it turns out it's not so much what genes you have, it's which ones get turned on and turned off. And so that's epigenetics, the things that alter gene expression without changing the genetic code itself. And so methylation reactions are a huge important way to turn off the bad, turn on the good, including there are so many bad genes on the X chromosome. Women get 2 copies of the X, guys get 1 X, 1 Y in every cell in our body. There's so many bad genes on the X chromosome. For a woman to be optimally healthy, she has to be able to shut down at least 85% of all the genes on that second X chromosome. Otherwise, you get excessive X chromosome impact on disease progression. And being able to methylate, turn off those bad ones in the X chromosome is vitally important. This X chromosome epigenetics is kind of the other reason, besides the estrogen dominance, that we think that 80% of all autoimmune disease happens in women.
I wanted to also just circle back to the topic of the conversation, which is hormonal imbalances and women's health, and kind of close it with that. I was curious, what's your take on hormone replacement therapy for women?
So when we get somebody who has all that hormonal menstrual stuff, Rev without calm stuff, or autoimmune disease, and we see this estrogen dominance, progesterone typically is totally tanked, and estrogen is running really high because of detox issues. And so that is such a dangerous place to be. You feel so crummy. You're not sleeping. You're anxious. You're a worrier. You got all this terrible stuff. We oftentimes use bioidentical progesterone. It comes in a capsule. It's a prescription medicine. And right away, we're trying to balance that estrogen progesterone, including if the woman has the right amount of progesterone, such as the capsule form. You sleep like a baby. You are so chill. And so we might say, well, let's start with 100 milligrams. But if you're not sleeping like a baby, totally chill within 5 days, you're not on the right dose. Increase to 200 milligrams. And then typically, if it's not the 100, it's 200 milligrams. Sleeping like a baby. Oh my gosh, that's great. Well, now you're sleeping. Now your body's going to be able to start fixing stuff. And now if you're sleeping well, you're starting to reset that circadian rhythm as well. That has this huge impact on everything. And then as you fix the gut and detox, estrogen starts coming down. But as you fix the HPA axis, you fix the vitamin D receptor in the gut, there's no reason a woman can't make all the hormones herself. So I used to do a lot more bioidentical. You never want to use hormone therapy that's not exactly like the hormones a woman would make. Bioidentical hormone restoration therapy. But that being said, you never want to take an oral estrogen, even if it's bioidentical, because it'll have a profoundly negative impact on the gut, create the leaky gut, but also the first pass metabolism through the liver creates all these toxic estrogen metabolites. So if you do bioidentical estrogen, it has to be topical. It can't be oral. But typically I find nowadays, the last 5-7 years, I don't use it very much at all. And not even testosterone in guys, because typically we can get the system to start making it all by yourself. And you see this all the time where the levels just start building. We go, oh, look at you making more of these important hormones that are going to keep you healthy long-term simply because we fixed the system as a whole.
So you can fix it, I'm assuming with younger women, but like some women that are in menopause, those estrogen levels are not likely to come back, including the progesterone. Or what are you seeing?
Yeah. So to your point, the ovaries make estrogen during your reproductive years, but then at some point, a woman goes through menopause and the ovaries shut down. They've been working hard for 4 decades. They're ready to retire, but such as like estradiol preventing heart attacks and strokes. A woman doesn't need a heart attack and stroke after menopause any more than they need it before menopause. It's just that then the body has to make estrogen a different way. And so typically what happens after menopause is the adrenal hormones like DHEA will then be released your whole life, but then the DHEA goes to the cells of our body, and it's the cells of the body that then convert it to the estrogen. You got to make that conversion at the cellular level. So things like the good bacteria in the gut, liver, kidneys, all these different body parts convert the adrenal hormones into estrogen, for example. And so a woman can keep making estrogen her whole life to keep the brain sharp, bones good, the skin good, all this other kind of stuff. You just got to do it a different way after menopause.
Okay, but even supporting like bone health and muscle strength and all those things that estradiol is responsible for in menopause, even topical or dermal applications of estradiol, you're not a fan of, even in menopause?
No, because they're so important to have these hormones. If you can't do it yourself, there's no reason you can't take the bioidentical. including, like I had mentioned, where if you use like bioidentical hormone restoration with estrogen, you build estrogen levels that actually helps fix the vitamin D receptor resistance.
Okay.
But then that helps you kind of make more of the estrogen on your own even. So even if you need bioidentical hormone restoration therapy, if you can fix the system enough, there's no reason you can't use it long term, but you may not need to because you might be able to start making it on your own eventually.
And with the progesterone, you typically go with the oral progesterone?
The topical is really good. The oral is really good. Both of them kind of do great things, but the oral tends to be a lot better when it comes to sleep, creating calm, and even has more of a protective impact on the cardiovascular system than the topical. It's just so easy to use. Insurance covers it typically. So I'll tend to use the oral because I really want to create calm. I really want to get to sleep good. And you can do it so quickly with the oral.
I'm just curious, what are the highest doses of progesterone you go up to, whether it's oral or topical? Because I know that some women need quite a bit more than others.
Yeah. So typically with the oral, 100, most women 200. Every once in a while, I've had to go up to 400, though that tends to be sort of a temporary thing. And then over time, they don't need so much. And gosh, it's been so long since I've used the topical progesterone. I'm not even sure I can tell you the dose. I want to say, is it like 20 milligrams per ml or something like that of the topical? And then you can go up to 40 and that kind of stuff.
Yes, I think it's about a quarter of the oral because its absorption is so much higher topically than orally.
Yeah. Okay.
Yeah, but the benefits are different as you described earlier. So I'm just curious, what motivated you to write your book, The Nurse Practitioner's Guide to Autoimmune Medicine, and how can people find that?
So I really feel strongly that people need to know that we know where this stuff comes from, but also we know how to reverse it. Unfortunately, most people are told we have no idea where it comes from. And then when somebody asks, well, how can I make it go away? There's no way to make it go away. You're stuck with it forever. So we're trying to tell people that's not the case. But truly, we really need somebody in every community that knows how to do this so that every community knows we know where the stuff comes from. We know how to reverse it. And so this is part of all the educational stuff that I do, like the courses that are available both for medical and non-medical people on my website, the book. So we're really trying to get a medical professional in every community. Even though the book, A Nurse Practitioner's Guide to Autoimmune Medicine, Reversing and Preventing All Autoimmune Disease, is ideally for medical people, it's also written for non-medical people. But I included in it 100 scientific references so that people understand that this isn't just one person's opinion. This is the science. This is, when I wrote the chapter in the textbook about managing pain in the presence of autoimmune disease, there's 150 scientific references, but I wanted to make sure I always use scientific references as we do with all my blog posts and all this. So people can reach me at drdavidbilstrom.com. And it's where all the information, videos, blog posts, educational courses, so that people can really educate themselves. And I think, if people really know where this stuff comes from and know how to reverse it, they can do a lot of work themselves, even if you're not a medical person.
Yeah, I highly recommend this book. I read it very quickly. It's packed with so much actionable knowledge, whether you're a practitioner or if you have a autoimmune issue yourself. I think we all need to take control of our own health, take responsibility. So even if you're not a health practitioner, for you to just learn and educate yourself, you can then go to your doctor and ask the right questions and be your own advocate. So I definitely highly recommend that. I know you have some courses. Tell us some of the courses that you also offer.
We have a free online educational email course called Medical Bill Detox. We also have a couple different levels of educational courses for medical people as well, as we try to get medical people in every community, and then all kinds of other educational material.
One last question to wrap it up. For women hearing this that are struggling with autoimmune issues, what is like one piece of advice that you would recommend to start their journey to healing?
Anything you can do to create calm really puts the body in a better place. So this is where you hear things like meditation, repetitive prayer, progressive muscle relaxation, getting out in nature, letting early morning sunlight hit your eyes because it projects to that HPA axis, creating calm in the body. And so anything you do to create calm just really sets the stage for healing, and then everything else can follow after that.
And that is it for today. If you've been listening to these episodes, you know optimizing your health isn't just about what you know, it's about having the right support to take action. That's why I built a private community where you can connect, ask questions, and get the guidance you need to actually make this work for you. One extra bonus, you'll also get full access to both Women's Biohacking Conference events coming up this year, live coaching sessions, and so much more. Head over to optimizewoman.com and get in now. I can't wait to see you there.